Thank you, Madam President. Colleagues, this bill deals with e-cigarettes, a growing phenomenon throughout this state and this country, a now multi-billion-dollar industry, which is doubling nearly every other year. Of great concern is that the fastest growth segment of new users is among middle and high schoolers. Middle and high schoolers who have never smoked a traditional cigarette are now smoking electronic cigarettes. They're advertised on television, they're advertised on billboards, they're advertised in magazines. The same public relations campaign that we know all too well from the 1940s, 50s, 60s, 70s with traditional cigarettes is now happening with electronic e-cigarettes. The industry would suggest that the emission is just vapor, as in water particles. In fact, the emissions are aerosols, and the California Department of Public Health has identified 10 toxic chemicals particles within these aerosols, which are listed among Prop 65 chemicals that are known to cause cancer, birth defects, and other reproductive health problems. So it's important that we regulate this industry, which currently is unregulated. And I do want to credit our former colleague, Senator Ellen Corbett, who was on this many years ago, before even the health advocacy groups took note of it. And thanks to her efforts, it is now illegal to sell these products to minors, but they are being marketed to minors. They're being marketed in flavors such as gummy bears and watermelon and Mountain Dew and sugar-sweet flavors to attract young people, and they're being very successful in doing this. What this bill will do to make sure that we don't lose another generation to the addiction of toxic and addictive nicotine is to begin to regulate the product as a tobacco product. And they are tobacco products, not just by definition of this bill, but by definition of federal law and proposed regulations that the Food and Drug Administration have out right now and will be formalized later this calendar year. Centers for Disease Control, along with our own California Department of Public Health, are all on the same page here. In fact, our California Department of Public Health is in the midst of a multi-million-dollar multimedia campaign using tobacco tax dollars to let Californians know, in their words, that these products are not safe, that they are dangerous. This is the bill dealing with these cigarettes that is supported by the American Cancer Society, the Heart Association, the Lung Association, the California Medical Association, among all the other advocacy groups. It's a serious issue. We have invested over $2 billion of public money and 25 years of effort in making sure fewer Californians become addicted to nicotine. If we don't address this and address it now and in this fashion, that investment will likely be out the window. I ask for your aye vote.
Thank you very much, Senator Leno. Dr. Pan.
Thank you. Actually, question of the author.
Senator Leno, please proceed.
I know that some of the opponents of the bill have made some statements about the definition of e-cigarettes perhaps as being not tobacco products, or that they should be separately regulated from cigarettes. Can you address the issue about the regulation of why we should be regulating e-cigarettes in the manner that you're proposing in this bill?
Thank you, Senator Pan. If I understand the question correctly, is why would we want to regulate them as tobacco products?
Exactly.
Okay. Reason for it, number one, they contain nicotine. Even in Products which claim to have no nicotine have been tested and have nicotine to be found in them. And again, we don't even know what are in these concoctions because they're unregulated. And so it's especially dangerous for children, but for anybody, because there are all sorts of chemicals. We don't know what they are, but there is nicotine in these products. And that, again, according to all the health organizations, is for a reason. It's addictive. It's also toxic, but it gets a new generation of market share addicted to the product. The federal government already defines e-cigarettes as a tobacco product. I'm reading from the federal definition of tobacco products. The term tobacco product means any product made or derived from tobacco that is intended for human consumption, including any component or part or accessory of a tobacco product. Nicotine comes from tobacco. And without digressing too much, but on point, interestingly, about 5 years ago, in the earlier days of this growing industry, one of the major players in the e-cigarette industry sued the Food and Drug Administration because the Food and Drug Administration had not yet been given authority by Congress to regulate tobacco products. All they could regulate are cessation devices. So this e-cigarette manufacturer didn't want to be regulated by the FDA, so they took them to court to argue they were a tobacco product. They were not a cessation device. They won in court. The court said, yes, you are right, you are a tobacco product. And on many of them, they even say that they are an innovative tobacco product. So for all these reasons, it makes sense that we regulate them as tobacco products.
Well, I really appreciate your answer, Senator. I am very concerned about the promotion of e-cigarettes to particularly our youth. I can see as I'm going, particularly in our more underserved communities, the intensive marketing. We know from the data there's a rapid rise, actually not only just a rapid rise, but a large number, which is also rising rapidly, of youth who've started using e-cigarettes as sort of their entry into nicotine exposure. And I think we need to be very concerned about exposure to nicotine. While some may use the e-cigarettes as a form of smoking cessation, I think more realistically, these are dangerous devices that expose people to nicotine, which is a very addictive substance. I think I agree with the senator that they should be regulated like tobacco products because they are tobacco products. They derive from tobacco, and that we need to do more to control the distribution and their use, and we should treat it like what they are, tobacco products. So I certainly, as a physician and someone who's concerned about the public health, urge and I vote on this very important bill. Thank you.
Thank you. Senator Stone.
Thank you, Madam President, members of the Senate. I stand in support of SB 140 and joining my friend and colleague from San Francisco on this issue. Earlier today, I gave a kind of a personal story about my mother that I lost at a very young age of 57 years old, who was diagnosed with breast cancer. After her death, we soon discovered that the origin of her cancer was not from the breast, it was actually from the lung. She had smoked for about 25 years, had quit, but the damage to the lung and the cancer-causing elements were still there and unfortunately metastasized to the breast, ultimately metastasizing to the liver, which claimed her life. And I also know that serving on the First Five Commission in the past 20 years as a local elected official, we've seen that tax go down. Why? Because we've had these tremendous educational programs showing the morbidity and mortality associated with cigarette smoking. And you may ask, well, why is he talking about cigarette smoking? We're supposed to be talking about vaping here. It's my belief and the belief of many professionals that this is nothing more than a gateway ultimately to getting people addicted to traditional tobacco. Tobacco use remains the single largest preventable cause of death and premature death in the United States, yet more than 45 million Americans still smoke cigarettes. It accounts for 6 million deaths worldwide, 480,000 deaths per year in the United States. 1 in 5 deaths in this country will be as a result of someone abusing tobacco. It costs our economy $300 billion a year, $170 billion in direct medical care for adults, $156 billion lost in productivity and premature death. And secondhand exposure, which is another issue of vaping, secondhand exposure to the nicotine. And today we're peddling these products on our kids with vaping shops that go unabated with cotton candy flavored nicotine concentrate, Tutti Frutti concentrated nicotine concentrate. Another concern that I've shared with the author is we need to make sure that these ultimately have child-proof caps, because we have kids that are smelling these and thinking, hey, this probably tastes good, and there have been instances of children dying from nicotine intoxication, something I hope that will further improve with this bill. But after years, with the help of the American Lung Association, the American Cancer Society, and educating people, the morbidity and mortality associated with cigarette smoking was doing positive things, and we're now creating a new generation of nicotine addiction via vaping. And I'll tell you, the tobacco industry spreads a significant amount of money promoting products that are known to cause cancer. In 2012, they spent $9 billion. That's $25 million a day to try to sell their cancer sticks. My friends, we need to stand up. We saw from 1965 to 2011 a decline in tobacco use in adults and high school students from 42% down to 18%. And now we're exposing a whole new generation of millennials to this fashionable way of smoking tobacco in a way that's going to jeopardize their lives. So I hope that you will join the senator from San Francisco and myself, a healthcare professional, in recognizing the dangerous precedent that we're going to be dealing with. Are we soon going to see the Marlboro Man on horseback touting this modern-day form of nicotine and making it attractive to our kids, not understanding the horrific addiction that nicotine can cause? I'll lastly just share with you that I had a very good friend, a landscaping friend of mine, 50 years old. 50 years old. My wife called him last week. His name is Nacho. Our water bill in our house doubled. My wife called the water company and goes, what are you doing? You're doubling our water bill. We've been conserving. They said, well, ma'am, you must have a water leak. And so we called Nacho, our friend, who agreed we did have a water leak. He fixed it and went across the street to help one of our neighbors. At 50 years old, he kneeled down to fix a piece of pipe, and he fell over from a massive heart attack. They used the paddles 3 times on this man. My wife and our neighbor rushed to the hospital along with the ambulance, hoping to see him recovering in the recovery room, only to have the physician come in and say that they unfortunately couldn't save this wonderful man who was addicted to smoking, was a multi-pack smoker, and I believe that that was a smoking that took this man's life. So I hope, as a legacy for many of us that are potentially going to be here for years, Senator Leno, who's been here for a number of years, this is an important legacy, because this is going to save a lot of kids' lives as they grow into adulthood. One of the worst addictions you can have, my friends, is nicotine. The worst. Heroin is one of the worst. Nicotine is just as bad of an addiction for somebody to try to kick. We're going to save lives with this bill. I urge your aye vote.
Thank you very much. Senator Huff.
Thank you, Madam President. Members, there's a number of bills related to tobacco products that we're dealing with. These require a thoughtful discussion. And certainly in my lifetime, we've seen smoking diminish significantly from my first experience in the workplace, with the blue haze that hung within the office building to banning public places. And, you know, while that discussion should be had and we should continue to reflect on particularly new technologies, nicotine is not, in e-cigarettes, not seen as tobacco products. This bill would bring it in, as well as some of the protections against that. Are we really telling landlords that they can't regulate what goes on within their apartments, or are we keeping people from using an e-cigarette from within 25 feet of a building? There's a lot of things that were designed specifically for the byproduct of tobacco smoking that this would encompass. And in many cases, e-cigs are used by people trying to kick the tobacco habit. And so I guess finally I would say that because the federal government is seeking national and plan to introduce national standards later this year, maybe we sit on this, make it a 2-year bill, and then reflect upon whether it goes far enough, considering what the federal government is doing. But today I would ask for your no vote.
Thank you, Senator Huff. Is there any more discussion or debate? Seeing none, Senator Leno, please close.
Thank you, Madam President. Colleagues, thank you for your comments. I'm sure the tobacco industry would be very pleased today if we made this into a 2-year bill. And their hope would be to make sure that at the end of the 2 years, it wouldn't go any further than this House. E-cigarettes are not a cessation device. The industry has not even applied to the FDA to become a cessation device. But if they do, and if they succeed, this bill will not impact them, because this bill does not address cessation devices. I do want to say respectfully to those who are addicted to nicotine and have made the decision to put down the traditional cigarette and to get their nicotine delivery through an e-cigarette. It's a choice this bill will not interfere with, and I don't think it's the place of government to interfere with that decision. And there are many reasons to do so. You won't make your house smell like an ashtray, but the nicotine will still be delivered. And people don't understand that. It's best to become nicotine-free, not cigarette-free. So 123 cities and counties in California have already done what this bill proposes to do today. It's time for the entire state to move in this direction. What it does specifically is brings e-cigarettes under our state's smoke-free laws, which will restrict where they can be smoked, as cigarettes are currently restricted. It will bring them into our licensing scheme like cigarettes, and additionally, we'll add them to our STAKE Act, the Stop Tobacco Access to Kids Enforcement Act, which will allow us to make sure that kids are not able to purchase these illegally. I ask for your aye vote.
Please call the roll.
Allen? Anderson? No. Bates? Bell? Aye. Berryhill? No. Block? Aye. Cannella? No. De Leon? Fuller? No. Gaines? No. Galgiani? Aye. Glazer? Aye. Hall? Hancock? Aye. Hernandez? Aye. Hertzberg? Aye. Hill? Aye. Hueso? Aye. Huff? No. Jackson? Aye. Lara? Aye. Leno? Aye. Leba? Aye. Liu? Aye. McGuire? Aye. Mendoza? Aye. Mitchell? Aye. Monning? Aye. Morlock? No. Morrell? No. Wynn? No. Nielsen? Pan? Aye. Pavley? Aye. Roth? Aye. Runner? No. Stone? Aye. Vidak? No. Wykowski? Aye. Wolk? Wolk, aye.
Please call the absent members.
Allen? Bates? Aye. No. De Leon? Hall? Nielsen?
Ayes 24, noes 12. The measure passes. File item 123, Senate Bill 124. Mr. Secretary, please read.
Senate Bill 124 by Senator Leno, an act relating to juveniles.
Senator Leno.
Thank you, Madam President. Colleagues, this bill will for the first time and finally define what the practice of solitary confinement is in our juvenile facilities and set some standards and parameters around the use of solitary confinement. The United Nations some years ago called upon all nations to absolutely ban solitary confinement for juveniles. This bill does not do that. As I said, it will define it and put some parameters around when it can be used. The County of Contra Costa just settled a lawsuit in federal court that was brought by advocates for disabled youth within our correction facilities who had been placed in solitary confinement and suffered greatly as a result. After spending over $1 million in legal fees, public dollars in legal fees by the county, they settled, and the settlement is very much identical to the contents of this bill. That solitary confinement cannot be used for punishment, but can be used to address a situation where a youth, one of our wards, is acting out in a way that makes the environment dangerous to other wards or to the staff, that it can be used up to 4 hours to deal with that incident. There is absolutely no data that suggests that placing youth in solitary confinement improves their behavior or improves their mental outlook. In fact, in over a majority of cases of suicides of wards in our institutions across the country, more than a majority were in solitary confinement. And among those who did commit suicide, over 65% had been in solitary confinement recently. This is a very dangerous practice. I've been working with the probation officers who are the responsible party within our system, been working successfully with them. They are not yet to a neutral position. I will continue to work with them to get there, but we have taken many amendments at their suggestion. So again, we know that troubled youth need access to education, need services, need a human touch. Putting them in rooms away from everyone else for up to 23 hours a day, and this does happen, is not the solution. It only exacerbates the problem. I ask for your aye vote.
Any discussion or debate on the measure? Any discussion or debate? Seeing none, please call the roll.
Allen? Anderson? No. Bates? No. Bell? Aye. Berryhill? No. Block? Aye. Cannella? No. De Leon? Fuller? No. Gaines? No. Galgiani? Aye. Glazer? Hall? Aye. Hancock? Aye. Hernandez? Aye. Hertzberg? Aye. Hill? Aye. Wesso? Aye. Huff? No. Jackson? Aye. Lada? Aye. Leno? Aye. Leyva? Aye. Liu? Aye. McGuire? Aye. Mendoza? Aye. Mitchell?
Aye.
Aye. Monning? Aye. Morlock? No. Morrell? No. Wynn? No. Nielsen? Pan? Aye. Pavley? Aye. Roth? Aye. Runner? Stone? No. Vidak? No. Wachowski? Aye. Wolk? Wolk, aye.
Call the absent members.
Glazer, aye. Allen? Aye. De Leon? Nielsen? Runner? Runner, no.
Ayes 25, noes 13. The measure passes. Colleagues, we will return to the order of third reading where we left off prior to the break. We will start with file item 116. Yes, 114. Senate Bill 736. Mr. Secretary, please read.
Senate Bill 736 by Senator Vidak, an act relating to escrow agents and making appropriation therefore.
Senator Vidak.
Madam President and members, I am pleased to present Senate Bill 736, which protects assets held in escrow accounts. SB 736 addresses this issue by providing the Department of Business Oversight with additional tools so they can hire conservators in the rare case that an escrow company fails. SB 736 has no opposition and has received unanimous support. I ask for your aye vote.
Thank you. Any debate or discussion on this measure? Any debate or discussion? Any objection to the use of unanimous roll call? Seeing none, ayes 38, no 0. The measure passes. File item 116, Senate Bill 11. Mr. Secretary, please read.
Senate Bill 11 by Senator Bell, an act relating to peace officer training standards.
Senator Bell.
Good morning, members, and it's my pleasure to present SB 11, co-authored with Madam President. This bill responds to growing public concerns by mandating additional behavioral health training that has proven to reduce volatile confrontations between police officers and people with mental illness or intellectual disabilities. Equally important, it recognizes California's diversity and requires the training to be culturally appropriate. The California Peace Officer Standing and Training Curriculum mandates 664 hours of training, includes 72 hours on how to handle a firearm, pepper spray, 40 hours of fitness, 40 hours of driving, but it has only 6 hours for mental, developmental, and physical disability issues, all 3 of those. There is no mandate that requires mental health training for continuing education. Lack of training has resulted in deadly results for both the officers and public, and individual surveys conducted estimate that nearly half of all police shootings involve people with mental illness or an intellectual disability. This bill will mandate 20 hours of additional hours of training in the academies and 4 hours of continuing education every 4 years. It will reduce deadly interactions between the police and people suffering from a mental illness or intellectual disability, increase officer safety, and save taxpayer liability costs by better preparing our officers for their public service careers. And I'd like to thank the staff of the Senate for arranging and the Madam President. Thank you for co-hosting the special hearing in Los Angeles we held on this issue. I request an aye vote.